Welcome back, everybody. Primary care docs and specialists throughout the country continue to see patients virtually. So what can and cannot be accomplished over the internet? The SLUCare Physician Group just launched its virtual visits program, and joining me is Dr. Matthew Breeden. He is a family medicine doctor with SLUCare. Good morning, doctor, and thank you so much for joining us virtually.
Hi, good morning. Thanks for having me.
Yeah. So making the rounds means getting out your smartphone or tablet. What can you do with this? You can't take a blood test or blood pressure, can you?
Well, blood pressure is interesting because a lot of patients today have their own monitors at home, and so they can often take their own blood pressure. And those machines usually take a pulse as well, so you get at least a couple vital signs that way. Most of us have thermometers as well, so you can get some basic vital signs pretty easily. Blood tests you're going to be limited on, but we can send patients out for those if they really need them. But a great deal can be done virtually. Most of the work that we do in medicine is history taking, and history taking is something that can easily be done over the phone or through a tablet.
I think people often underestimate the amount of knowledge a doctor can get through that conversation that you have. And you can also see them. So I'm sure there are things you see and you go, well, that doesn't look right, right?
Absolutely. You can tell a lot just in a person's face and their demeanor and the way they move and talk and breathe. You can tell if they're having difficulty breathing, are they in pain. Things like rashes, you can usually visualize pretty easily. And phones these days have such high definition cameras that you can see quite a bit. So you can really assess a lot over virtual visits.
That's fantastic. As far as current patients, are you seeing new patients this way?
We are. Our practice has decided to bring in new patients as well as established patients into this virtual model. The new patients need to do a little bit of work ahead of time to get their paperwork filled out, but it's the same kind of work they would have to do if they were coming into the office anyway. And we can still bring them on just as we would normally.
Are people more apt to talk about more easily when they're in their home rather than in an office visit?
I think so. I think it really opens things up. People feel more comfortable at home. Some people really don't like going to the doctor, as you might be able to imagine. And so being able to do it and break down some of those barriers and do it from home or from a comfortable location, for a lot of patients is really a great benefit. I'm seeing patients I haven't seen in years just because they feel more comfortable doing this virtual visit than the visit in the office. So it's been very nice.
Can you prescribe medication?
Absolutely. Most, if not all of our prescribing these days is done electronically. And so it's done directly through the software that we use to conduct care, and so we can prescribe most medications electronically now.
And I know that's expanded during this period too, where you used to have to go and get the script from the doctor. Now they can send it right to the pharmacy for the first time.
Absolutely, virtually anything.
All right. Well, are these appointments, they're covered by insurance, are they not?
Yes, sir. The decision was made as a result of all of the issues going on with coronavirus that insurance companies would start to cover telehealth visits because they knew that patients were going to have difficulty getting care otherwise. And so our goal, as always, is to provide the care that patients need when they need it. And insurance companies have agreed with that goal and agreed to help cover these costs just as they would any normal visit.
Okay. Well, you're not going to charge me for this visit, are you?
I don't think so. Unless you logged your insurance with us, I think you'll be safe.
That's right. Yeah, my name is Chris Higgins, by the way, if you're going to charge. Thank you, Dr. Breeden. We appreciate it.
Thank you very much.
Yeah. We have a link on Fox2Now.com and the Fox2 mobile app if you want to check out the SLUCare virtual doctor meetings.